Hello everyone, I'm Dr. Disha Kaj. I'm a consultant radiologist and fetal medicine expert at Momstory, Harapsar. Today I'm going to shed some light on what is called as a transvaginal ultrasound. Now most women feel embarrassed or they feel anxious when they hear this about TVS scan or transvaginal ultrasound. I'm just going to make things a little simpler for you. So what is transvaginal ultrasound? Transvaginal itself means through the vagina. So basically it is a type of sonography which is done by inserting a probe inside your vagina. Why are we doing this TVS scan or a transvaginal scan? Okay, so whenever we want to get a better, clearer picture of your uterus and ovaries, that is of your pelvic organs, a TVS scan gives us that information much better than what a transabdominal scan would do, and that is why a TVS scan is advised. Most common indications that we encounter are whenever we are evaluating for infertility, to check for your uterus anatomy, to check for your ovaries, to check for your follicles in case of follicular monitoring, to check for causes of heavy menstrual bleeding or postmenopausal bleeding, to look for any fibroids or any cysts, to also look for early pregnancy before 8 to 10 weeks. It shows us the baby and the heartbeat at a much early stage to diagnose any ectopic pregnancy. Later on in pregnancy, to look for your cervix or to look for the placenta. So there are multiple applications of this ultrasound, and that is why it is very essential that you do not have any fear or any myths related to this transvaginal ultrasound. Okay, now is there any contraindication like kabhi nahi kar sakte hai? Supposing you are not sexually active, a TVS ultrasound is not advisable because it can cause some amount of pain and bleeding. Hence, in patients who are not active sexually, we do not advise a TVS scan. Now, I'm going to break some myths which are related to TVS scan and give you a real picture of what exactly happens. So, myth number one, TVS is always very painful. Reality is, it is not usually painful. It just causes some amount of discomfort to you. Most of the times, relaxing yourself, taking deep breaths, relaxing the pelvic muscles helps, and it reduces the sense of pain, which is just anxiety and fear inside the mind. Myth number two, TVS cannot be done when you are menstruating or when the periods are going on. Reality is, it is absolutely safe even if you are menstruating. In fact, if we want to look for causes of heavy menstrual bleeding, it should be done. Myth number three, by doing a TVS scan, it will increase the risk of miscarriages or abortions, or it will cause harm to my pelvic organs. Reality is that it does not increase the risk of miscarriages. In fact, we are not going to touch the baby with the probe, or we are not going to touch any of your internal organs like the uterus or the cervix with the probe. So it is not going to cause any harm to your pelvic organs or to the baby, or neither it is going to cause any increased risk of abortions. Myth number four, if a TVS scan is advised, it is some reason to panic that something is very wrong with me. Reality is, it is a commonly done type of ultrasound nowadays, and there is no reason to panic. It just helps your gynec to complete the examination with respect to your pelvic organs. So my take home message for all the women who are watching this video, transvaginal ultrasound is a completely safe, usually not painful type of sonography. Please talk to your doctor about any concerns that you have. In short words, it is something that is meant to help you and nothing to fear from. For any further information, please visit Momstory.